Today, I would like to talk about neurological condition called Tourette syndrome, often referred as TS. So what is Tourette syndrome? Tourette syndrome is a neurological condition that is characterized by involuntary movement and sound known as tics. These tics are sudden, repetitive, and often unpredictable, making it a condition that can greatly affect a person's daily life. So when tics appear, tics generally begin to appear between the ages of 2 and 15, with the average onset being around 6 years old. This means that children may show signs of TS quite early in their development. It also said that males are significantly more likely than females to develop TS, with the being about 3 to 4 times higher. There are three main types of tic disorder. First is provisional tic disorder. This is the most common type of tic disorder in children. It affects up to 20% of school-age children and usually appears early in life. A diagnosis is given if a child exhibits one or more tics, whether motor or vocal, for at least 1 month but less than 1 year. Often provisional tics disappear on their own within the year. Second is persistent motor or vocal tic disorder. This condition involves long-lasting tics, either motor or vocal, but not both. Tic can persist for more than a year and typically appear before the age of 18. However, chronic tics occur in less than 1 in 100 children. Third is Tourette syndrome. This is the most severe type of tic disorder. If a child has both motor and vocal tics, they may diagnosis with TS. Tourette syndrome affects approximately 1 in 162 children in the United States, and symptoms usually emerge between the ages of 5 and 10, and TS usually lasts for more than 1 year.
The genetic causes of Tourette syndrome is missense mutation. A missense mutation is a type of genetic change that swaps one amino acid in a protein for another. This can change how the protein works and sometimes lead to problems. Some individuals with Tourette syndrome have been shown to have variations in the SLI-TRK1 gene and histidine decarboxylase. The first one is SLI-TRK1 gene. This gene helps with the growth and connections of nerve cells, which are essential for communication in the brain. If a missense mutation occurs in SLI-TRK1, it might interfere with these nerve connections, possibly affecting brain circuits linked to Tourette syndrome. Second one is histidine decarboxylase gene. These genes help produce histamine, a neurotransmitter that affects brain activity. A missense mutation here might disrupt histamine levels, throwing off the balance of brain chemicals, which could worsen Tourette syndrome symptoms.
Tourette syndrome has two types of symptoms, namely physical tics and vocal tics. Physical tics, also known as motor tics, are involuntary, repetitive movement or gesture that a person with Tourette disorder may experience. This movement can affect different parts of the body and may range from simple, brief action to more complex, purposeful seeming movement. For example, blinking eyes rapidly, making eyes rolling, facial grimacing or twitching, shoulder shrugging, and jerking of the head or limbs. Vocal tics are involuntary sounds and noises made by a person with Tourette syndrome. These tics involve the vocal cord, throat, and mouth, and can range from simple sound to more complex vocalization. Vocal tics are sometimes referred to as phonic tics. For example, grunting, whistling, clearing your throat, clinking your tongue, and making animal noises.
Tourette syndrome is a neurological disorder characterized by repetitive involuntary movement and vocalization known as tics. The exact cause of Tourette syndrome is still being researched, but recent studies point to the genetic mutation as the key factors behind its development. In particular, the SLIC1 mutation and the HTC mutation are two of the most significant genetic changes that influence disorder development. Today, I will provide a detailed explanation of how this mutation contributes to onset of Tourette syndrome. Let's begin with the SLIC1 mutation. The SLIC1 gene encodes a protein called SLIC1, which plays a vital role in the development and functioning of the brain. Specifically, it's involved in neurite outgrowth, the process by which nerve cells extend their axons and dendrite to form connection with other neurons. This is a crucial, proper form of communication within the brain, particularly in circuits involved in motor control. Mutation in SLIC1 can disrupt these processes in different ways. First, ADDL126-4C mutation causes a truncation of SLEET1 protein. This truncated protein is non-functional, meaning it can no longer perform its role in brain development. Second, other mutation can reduce the expression of SLEET1, meaning less of the protein is produced, further impairing neuronal communication. Both these mutations lead to defective cortical striatal circuit, which are key brain pathways that regulate movement and behavior. These circuits are responsible for controlling motor actions, and their dysfunction can contribute to the tics observed in Tourette syndrome. In essence, when these circuits don't function properly, the brain struggles to control voluntary movement, leading to the involuntary tics associated with the disorder. Next, we will explore the HEC mutation. The HEC gene is responsible for encoding the enzyme histidine decarboxylase, which is involved in the production of histamine. Histamine is a neurotransmitter that plays an important role in the regulation of several functions in the brain, including arousal attention and motor control. In the context of Tourette syndrome, histamine helps maintain a balance between other neurotransmitters, particularly dopamine. When the HTC gene is mutated, the production of histamine is decreased. This leads to an imbalance in the brain's chemical environment. Specifically, low histamine levels result in elevated dopamine activity within the basal ganglia, a region of the brain involved in the motor control and habit formation. Excessive dopamine in the basal ganglia can cause motor control issues, which contribute to the development of tics. Dopamine is a key player in the reward system and motor movement regulation. So, when its activity is dysregulated, the result is the involuntary movement and vocalization seen in Tourette syndrome. In summary, the SLEET1 and HTC mutation both contribute to the development of Tourette syndrome, but through different mechanisms. The SLEET1 mutation impairs the development of crucial brain connection involved in motor control, while the HTC mutation causes a neurotransmitter imbalance, increasing dopamine activity in key brain regions. This mutation leads to dysfunction in the circuit that govern voluntary movement, ultimately resulting in the tics that are characteristic of Tourette syndrome.
Next is the diagnosis of Tourette syndrome. Common tics are often diagnosed by a primary care provider, pediatrician, or mental health care specialist. Atypical symptoms, which are different from classical symptoms, or atypical presentations, for example, symptoms that begin in adulthood, may require additional expertise for diagnosis. There are no blood, laboratory, or imaging tests needed for the diagnosis of the syndrome. To diagnose Tourette syndrome, a doctor will ask you about the duration of tics occur, whether it occurs several times a day, every day, or intermittently for at least 1 year. Other than that, onset of tics before age 18, which are tics that might already happen before you reach the age 18. And also tics that are not caused by medication, other substances, or medical conditions. In rare cases, neuroimaging studies or certain blood tests may be used to distinguish conditions that might be confused with Tourette syndrome. Lastly, management of Tourette syndrome. Currently, there is no cure for Tourette syndrome, but treatments are available to help manage some symptoms. It is common for people with Tourette syndrome to have other conditions like ADHD, anxiety, and OCD. People with additional conditions will require different treatments based on the symptoms. One of the management will be medications to help suppress tics and ADHD symptoms. Some of the medications suggested by doctors are medications that block dopamine like haloperidol, alpha-adrenergic agonists such as clonidine, stimulant medications such as methylphenidate, and also antidepressants, specifically serotonin that reuptake inhibitors. Some medications may have or cause side effects. It should be carefully managed by a physician or healthcare provider. Next is behavioral therapy. Behavioral therapy such as awareness training and competing response training can be used to reduce tics. A recent National Institutes of Health funded multi-center randomized control trial for cognitive behavioral intervention for tics, CBIT, which they include habit reversal in addition to other strategies, education about tics, and relaxation techniques. CBIT has been shown to be effective at reducing tic symptoms and tic-related impairment among children and adults. Other than that, psychotherapy. Psychotherapy can help individuals cope with the disorder and deal with accompanying problems or conditions, including an ADHD, with depression, anxiety, and OCD. Lastly, supportive therapy. Supportive therapy can help a person with Tourette syndrome better cope with the disorder and deal with the secondary social and emotional problems that can occur.
Is our references. The conclusion of our presentation is Tourette syndrome is a neurological disorder that causes individuals to experience repetitive, involuntary movement and sound, known as tics. It typically begins in childhood, can vary in severity from mild to more disruptive form. While the exact cause of Tourette syndrome is not fully understood, it is believed to involve a combination of genetic and environmental factors. Though there is no cure, various treatments including behavioral therapy and medication can help manage the symptoms. With proper support, many individuals with Tourette syndrome lead successful, fulfilling lives.